car about 20 minutes. We were on way down to UCSD Hospital in La Jolla. So we just recently, very recent, found out that that I am pregnant. About 9 weeks right now, and it is a super rare high risk pregnancy. It is a cesarean ectopic pregnancy. Because I have had 6 previous C-sections, it's super dangerous. The scar tissue, the embryo has implanted itself into my C-section scarring. So I've done quite a few ultrasounds recently at hospitals in San Diego, and they decided that we needed to go in for a quick last-minute emergency surgery where they're going to inject chemo into my uterus while I'm in the operating room in case they need to do a DNC. How do you feel about this?
Tired. All the lights on the road are blending together.
Yeah, it's super early.
And I'm hungry.
You can't eat. I can't eat. You can't eat. So this is a 2-part surgery. This is the first part. If I don't do well, then I need to stay overnight. Otherwise, I should be home by dinner time tonight. So the second part is we need to do more ultrasounds and beta HCG levels at the lab over the next few weeks. And then that will tell the doctors when we can go in for the next surgery, where they put me to sleep, they do the DNC, and if I'm bleeding too much, then hysterectomy. I did ask one of the doctors if I could just get a hysterectomy from the beginning, because of like PCOS and other issues, and the pregnancy stuff with Ricky.
What do you mean me?
But they said in my case, having 6 previous C-sections with all the scarring, hysterectomy is a high risk for bleeding and hemorrhaging for me. So they're just trying to figure out the best way to treat this situation. So with all that said, if I don't end up with a hysterectomy from this, then yes, Ricky is getting a vasectomy. We're just waiting it out to see what happens.
The boys are going to hear you say that. Alright, so I'm out here in the parking lot of UCSD while Haley has her surgery. Doctor said it should take about an hour, but we're parked so far away that it took me like 30 minutes to get here. I need my breakfast. I'm starving. Hopefully everything goes off without a hitch. Wow. Do I got a hole? Do I got a hole in my lip somewhere? Man. Anyways, hopefully everything goes off without a hitch. I mean, it seemed like they were fairly well trained or well versed in this surgery, and everything was pretty much in place and ready to go. And if something were to happen, they've already had the countermeasures set aside to take care of it. Dang. We ain't even gonna use this one. Ah, never mind. Alright, so I know this isn't the typical funny whimsical episode or whatever. But Haley always said, you know, that she just wanted to put us on YouTube to share our experiences. Because it's always something, always something. You know, we discussed it, whether or not we were going to record this and put this on, but she said, really? I mean, why not? And I guess I'm with her on it, you know. I have no shame in my game. I mean, so hopefully everything turns out all right. We'll be out of here in a couple hours. They said recovery time is about an hour. If something were to happen, it's going to prolong her leaving. Okay, so, and I just got the call saying everything went perfect. They couldn't expect it to go any better. And she's in recovery right now. And they're gonna give me a call when I can go and see her. So we're leaving the car now and give her mom a call and let her know that Haley is okay. So we'll see you soon.
Okay, out of surgery, headed home.
How you feel?
Fine, just tired and a little bit
Bequeathed?
a little bit of pain, that's it.
Fair enough.
I'm gonna go home and sleep. Hopefully we've got that baby at home. Stacy came by and visited. That was nice.
Dude, I haven't seen her.
She was one level up.
Nuh-uh.
Yeah. For the last few weeks, we've been in and out of the hospital with them monitoring me through ultrasound, blood work, and everything. Waiting for a good time to do my second procedure. I had the first part procedure last Monday where they injected chemo into my uterus to try to help shrink the pregnancy and loosen it up to kind of get it away, or try to get it away from the C-section scar, because it's embedded in there, making it non-viable. Then after that surgery, the plan was to monitor me closely for 2 to 4 weeks to see when they would be comfortable with doing a DNC procedure with me asleep, just in case of all these possibilities of like extreme bleeding, hemorrhaging, needing an embolism to the arteries, or hysterectomy with the vertical scar, or a few others. They would need to wait until the pregnancy was less mature and smaller to do this procedure, so it won't be so large for them to evacuate, which would cause greater risk to me with bleeding. But unfortunately yesterday, bleeding was happening pretty bad, as well as a lot of pain. After emailing my doctors, they called me and said they needed me to come in as soon as possible yesterday to be seen after blood work and ultrasounds and quite a few other tests that were not so fun. They determined that I needed to have the surgery right away. So they put me to sleep, had the DNC with hopes of no excessive bleeding, and it went well and successfully. It was a lot more mature than they anticipated, than any of us thought. But, not, it wasn't alive. So country with her family. That's what we're dealing with, but we love it. We can't get enough of her. Okay, so Friday I was supposed to have my post-op for my surgery, for my second surgery, but they had to cancel due to emergencies, so they scheduled it for Monday. Today's Monday. Came in, and there's a few more things going on that they don't, that they didn't anticipate going on. With the surgery, they couldn't be as aggressive as they wanted to be with...
Aggressive?
Yeah,
Don't
with
be aggressive.
removing the pregnancy. The already non-viable pregnancy. They couldn't be as aggressive because of bleeding. They didn't want hemorrhaging to happen. So with that came not being able to remove the entire pregnancy. So there's still stuff going on with me that we're going to be dealing with for a little while. I have another appointment in 2 weeks. Aubrey here was my buddy today. They said no one under the age of 12.
I'm lying.
So we lied. No, I'm kidding. They let her in. My doctor is so great. I love her so much. And now we're going back to where?
Ice cream.
Our home at the campground. That's the only reason you like to come with me.
No.
You're hoping I'll get you ice cream.
No.